Hey, you guys, follow along with me today as I attend the event called Sacral, which is a women's wellness divine experience, and divine it was. Let me tell you what we enjoyed for the day. Everything you can think of. We had times of communal conversation, great feasting, testing of different products. We talked about improving our sex health. Do you know your flirt language? Well, find out with tips from experts, learning about fertility and enjoying the process of aging, having a revolutionary mindset. Tap into your feminine energy. It was indeed a fulfilling experience, and I just want to take you along with me so that you too can be in the room where it happened. And listen, everyone, when I tell you the information that was given during this experience was top notch, I am not kidding. Don't forget, at the very end, I will be unbagging some very important products that you should be aware of. And of course, I'm always happy to share my personal and professional insight with you guys, as always. But before we get into the nitty-gritty of the things, I ask you to do one thing and one thing only. Don't forget to like, share, comment, and subscribe. Okay, maybe that was more than one, but you got it. Okay, so these are individual kits that patients can buy on their own.
And then take to their provider to use. It's HSA, FSA eligible.
That's fantastic. Doesn't it make sense? The more you practice gratitude as your attitude for life, the more you are going to reap the benefits of that, not just in your regular life activities, but in your sex health as well, in your relationships. That mindset changes everything. Hey, you guys. Happy day. I'm excited to attend Sacral today. It is a divine women's wellness experience. And so I'm excited to see what they have in store for us today. I expect great things. I am so excited to meet Angie Hughes, who is the owner of Wepa Beauty. So let's check it out. So, you guys, while I can't share everything that happened or took place, I'm definitely going to take some clips that I thought were really key messaging from this event. It just means that the next time you need to be in the room.
Thank you for taking the trek all the way out to different parts of Los Angeles.
Thank you, Rebecca. So, just so everyone knows, Rebecca did this all.
So one particular topic that I absolutely appreciated today was the fact that the panelists, whether the conversation was about fertility or otherwise, or wellness in other aspects, the clinicians made the point of talking about how we view hormones. And we view hormones currently as something that is static, knowing that our hormones shift from day to day, from moment to moment.
You know, let's all have the perspective. This is the privilege of being alive, right? But there's this overall societal, gets into every single one of our nooks and crannies that aging is bad, right? Like, how many booths here are about making our skin look beautiful? And I'm not saying that's bad, I do Botox, right? But this is part of our culture, where there is this loss of fertility, this aging decline creates this shame in each of us, which shouldn't be there, but we should just acknowledge that it's there so that we, can manipulate things that you understand a little bit. So overall, estrogen is declining. Even if in perimenopause it's up and down and up and down, overall, we have less than we used to have. We have this, with this change in hormones, we have this emotional ability, or get anxiety and depression. Women who have never had anxiety and depression before, all of a sudden can feel super anxious during this time. And it's not in your head, I mean, it is in your head, but it's not in your head, right? These are real changes that are happening. In the UK, where they can do large population studies, they see that in places where they prescribe more hormone replacement therapy, they use less SSRIs, or anti-anxiety medication, which is huge. It tells us a lot about what's happening in this hormonal transition. We have body composition changes. We talked about how our insulin resistance, estrogen decreases our sensitivity to insulin, causes us to have more insulin in our body. Insulin holds on to fat. We have fat around our midsection, even though we're eating the same number of calories. So whoever told you it's calories in, calories out is definitely not the whole story, right? We get poor sleep. Women are tossing and turning and tossing and turning at night. What do we know about sleep? Sleep is so integral to every single part of our body. It's important to our heart health, our brain health, to how we function in the world as soon as the following day. And sleep is definitely affected in midlife. Our pelvic floor changes. We talked about the decreased blood flow overall. The decreased blood flow causes changes to the skin in the labia, waking up in the middle of the night to pee 12 times. That's bad for our sleep too, right? The tissue can become thin and you can get pain with intercourse. So a lot of different things you can do for that, and let's talk about what we do. So it's not that we all of a sudden have new information that took away this black box warning. No. This is the same information that we have. We just analyzed it. It's what actually removed this black box warning. So when you actually look at the data, estrogen doesn't cause breast cancer. It decreases. Did you hear that? Decreases your risk of breast cancer by 26%. Woo! That is huge. Women who are on hormone therapy at the time of getting breast cancer, because people get breast cancer for lots of different reasons. Because of genetics, because of environment, because of age. People on hormone therapy at the time of getting their breast cancer have a less severe form of disease and less chance of dying from their breast cancer than women who are not on hormone therapy at the time of getting breast cancer. That is really big. Now, what is the number one killer of women in the United States?
Heart disease.
Heart disease. Yeah. So we have so much data showing that if you start estrogen, estradiol, early, so within the first 6 years of perimenopause, menopause, women have decreased risk of heart disease, decreased intimal wall thickness. That is huge. That is really, really huge. So things that we should talk about and understand that estrogen is not super scary. And then estrogen for the vagina is safe for everyone, even people with active breast cancer. So super, super, super important.
Sometimes I get frustrated with these headlines too, right? How to ignite or, revamp your libido and desire. I think a lot of it has to do with play. What I noticed with my clients and myself included is I don't play enough as I should. And that can be anything, it could be grooming and getting ready. It could be actually going out and doing something recreational, but that's connected to our sexuality quite a bit because libido is life force energy. It's what we put towards what we're passionate about. So low desire often means low energy. We're not putting it towards things that excite us and motivate us. And also I think gathering like we're doing today is also good for our libido. Being in community with other women and playing and talking and getting to know each other and socializing and learning things is so good to help us get back to desire. So biggest thing to remember is it's not going to fall out of the sky and just happen one day. We have to work towards it. And that's why we want to bring in the play. It's fun. It's something that we can each do for ourselves, and it's different for every single one of us. That's why I don't love the top 5 tips to boost your desire, because it's going to be different for all of us. So we need to share too with each other what works and share the wealth, no gatekeeping when it comes to pleasure.
I talk about all the time is flirting. It's one of my specialties. And if we're thinking about bringing play back, if we're thinking about bringing pleasure to your life, it's about getting back into flirty energy and flirting. And so one of the things that's really important, especially like if we're in long-term relationships or we're on a fertility journey, are we in flirty energy? Maybe not. Maybe we're a little stressed, right? How do we bring that flirty energy back to our relationship? And so the first thing about the science of flirting that is really interesting is humans flirt for 2 different reasons. You flirt for connection or you flirt for entertainment. And so with couples, or even if you're on a fertility journal but maybe you're single, like bringing flirty energy and normalizing that that's okay is the first important step, because you naturally flirt for entertainment. That means it's not cheating, you're not bad, it's not wrong that you notice that the hot barista also noticed you, and maybe you're married, but so no one has looked at you like that all week because you guys are in baby mode, and it's okay to be in that energy. Actually, if you just acknowledge that and own it and maybe have a little flirt, you're going to create more energy when you get home. And so when we start suppressing and cutting it off, that you're cutting off energy that you can also bring back to your relationship and bring back to your fertility journey. And so that's one thing to just normalize. You're not wrong or bad, and neither is your partner. How can we talk maybe about bringing flirty energy back to our lovership? You know, bringing play in. I love getting flowers or plants because that changes the energy of your space. Especially flowers, it can really like bring flirty energy back, bring romance back. I also have something called the Flirt Quiz at pleasurescience.com. If you go to pleasurescience.com/flirt, within 3 questions I can tell you what your actual flirt style is. Everybody has one. And so for couples, this is really great information because you could say, oh, I never realized I'm a complimentary flirt. I love to compliment.
And like love languages.
Yeah. And then you can think, you see your spouse like, oh, and my spouse is a subtle flirt. They do a lot of acts of service, but they're not very talkative. When you have language for how you connect in a flirty way, this helps your relationship create more space for flirtation. So that's always like a good place that I like to start. But what do you think about flirting? Because you have a hot and spicy connection with your love too. And you can feel when couples have electricity. I feel like you're good at flirting. And what would you have to say about it?
I would say when I think about flirting, get weird. It's important to get weird. Don't be perfect. And you know, even using weird language, my husband and I will do that. We'll say really weird things to see what kind of reaction we can get out of one another. I think flirting is social connection. It's meant to be something we practice and we figure out what we like, what words we like. It also can be nonverbal. It's how you move your body. Body language is so underrated when it comes to how it can evoke our arousal and our desire. So practice, you know, moving your body in a certain way. I loved watching all of you dancing earlier to see just how you were kind of getting embodied with your own pleasure. I think that can be a good way to flirt. And it's kind of like a dance. So if your flirting doesn't land really well with your partner, don't feel like you failed. You know, learn from observation or ask for feedback. I think it can only get better.
Absolutely.
I was thinking Dr. Tuvi's speech about how important this actual conversation is. It's honestly not a conversation that I have enough, and I need to start having it with patients more so, because so much of the fertility process nowadays can be kind of mechanical. And we need to have intimacy, we need to have pleasure, we need to have love alongside the science. We need to have them in tandem, supporting each other. So I'm going to start having those conversations Monday in the office. I guess Tuesday actually.
In your day, when I work with a lot of long-term couples, I'm like, how can we have these little drop-in moments of intimacy? And one is like just holding hands more, hugging each other more, squeezing. I always like to tell my lovers to squeeze my bones, wrist bones, yeah, shoulder bones. It's so nice and grounding. And again, you can like drop in with your lover. And another helpful thing, if you're struggling with intimacy on the fertility journey, plan intimacy playdates. So it's super healthy and good to schedule sex, because listen, we're busy, okay? And it makes sure that like we're gonna have time. But sometimes if you're an overthinker or you have anxiety, scheduling sex can be like, oh my God, I need to commit to being on and ready on Tuesday at 7 o'clock. Now I'm anxious. And so having intimacy playdates can be really nice, where it's like, we're gonna schedule time, no family, no in-laws, no kids, maybe no fertility talk or whatever. On Tuesday at 7, we have 2 hours to just be naked together and watch a movie. There's no expectation for sex, but we're creating an intimacy playdate, so that way we can reincorporate intimacy back into our love life at a time that might be stressful and full of planning and full of rejection, where maybe it's not you two rejecting each other, it's the doctor saying, oh yes, we have to wait another month, or it's the, right? Like it's the rejection that happens in this situation. So planning intimacy playdates is also really, really helpful.
I hear a lot about novelty and newness. It's, you know, feeling your best. And sometimes if we're in the same habits and rituals at home, where we're in our sweats or we're not dressing up and getting excited about each other, then that can cause this loss of attraction or desire as well. So sometimes it's just feeling your best and encouraging your partner to do that as well. I think Dr. Tuvi brought up Esther Perel. If you haven't read Mating in Captivity, I highly recommend it. She talks a lot about, you know, having that longing for each other builds that attraction, gets us excited about one another. And also, I would say, reflecting on how you're feeling about yourself. Often we project that. When I'm not feeling great or my most confident self, I feel that it's my partner, my relationship, my job, so good self-reflection on what's going on beneath the surface, especially the things in our shadow self that we don't talk about or share with anyone else.
Thank you. That's good.
You can read them, and it's exciting to read your own words as well as it is your partner's words. And speaking of words and speaking and communication, I want to give you all permission to make some noise when it comes to pleasure. Flirting, communication, but also just making noise. We're primal beings and we respond, our desire responds to sound. So if we hear little moans and groans, even our own sounds, that can turn us on. I think we should all make a little noise together when we say a nice little inhale and moan. Ready on the count of 3. 1, 2, 3. Feels so good.
One of the themes that I thought echoed very well between all of the different specialties was really acknowledging the fact that up here, that beautiful organ we all have is our secret weapon. It is the biggest and best organ when it comes to our sex health. And oftentimes when people come in with concerns or issue about their sex health, we're so focused on the physical, but so much of it is relational and psychological.
Okay, does anyone have like crampy cycles, like crampy periods? Okay. Best exercise for easing cramp. You've done this before. You just bring the leg back and forth and just release it. Yeah, I love the creativity here. And then this releases any kind of cramp or pain. Significantly releases pain and both sides. Yeah? So what happens when we are sitting too much, these pelvic muscles become super rigid and tight, right? So you want to bring I love this group. I love that you guys find the humor in this. Okay, so you're releasing tension. Okay, now be back to work because I give you a little break here. Okay, feet together, bend your knees, and then slide one leg forward. You remember the pelvic tilt? Here we go. And it feels really good. You know why? Because we never do this. So, your heel, knee, and pelvis moves together. Flex, release. Bring in the hands. Flex, release. Flex, release. So, we have again this blood flow coming to life, but also inverting with the one side. So, knee, the right ovary gets a little triggered, squeeze and release. Squeeze the ovary and release. Right? Very good. I mean, you guys are insane.
There's so many women who spend that 6 months taking some supplement thinking it's going to help and end up losing 6 months of their fertility cycle.
I want to go more holistic or whatever, you should be seeing both hand in hand, because I agree with Tali, which is that she's like, sleep is integral, so is all the other things that kind of flip. In this world, we've become so immune to how much stress and how much in the rat race we are, that we forget that all these things really have an impact on our fertility as well and increase inflammation in our body. So I think sometimes science is so strong that it can kind of override some of these things, but is that always better? And will that be better for the pregnancy? And will that be better for your pregnancy after? Like, ideally, you're addressing both together so that you're not, if your doctor, like if your medical doctor thinks like, okay, listen, you're young, you have a good reserve, if you don't mind spending 3 months, decreasing inflammation before trying to get pregnant, go for it. But if you're 42 and your biological clock is really ticking and, all of that stuff is kind of like a cherry on top, not going to make the difference, then I don't want you, only doing that and then coming to see me 3 months later.
About the stress that I was like, I'm totally stressed and it's stressing me out, and because I'm stressed, I'm more stressed, and it's a really bad cycle, and we get it, and sometimes I say to clients now, like, I don't want you to be stressed, but also this is really hard and you're going to be stressed, so let's just acknowledge it and move into it. How do you guys feel about stress and infertility, and how do you treat it?
It's an excellent question. It's
One of the main, I feel like I should be validating your questions.
Yes, I'm horrible. She hasn't said one of my questions is excellent. Favorite. She said them all. They're all excellent questions.
I think so much of the fertility journey is oftentimes in the dark, and so many patients feel this feeling of like, who do I talk to? What's my community like? What are my, who's my tribe? Who are my friends? Who are my family that I can really open up about this? And I think the isolation, that feeling of loneliness, is one of the most challenging things about the fertility journey that causes that stress. And it's also, not having faith and not having that trust. And also, it's not everyone's. Dare I say this? I know that it's bold. I know that it's raw. It's not going to be everyone's truth, and that's really scary. But it is going to be a lot of people's truth. And I know to say that, but like that's really where my heart comes in. It's like understanding that fear is valid, but having that faith is even more important. And also being surrounded by people that you can trust and lean on. Having people like you, having people that we can really be seen and have that community is extremely important. And I think as well as supporting the nervous system. I mean, there's so much research around acupuncture. There's so much research around the impact of nervous system in terms of cortisol and sleep. We need more support with the foundations of community, of relationships, and also of supporting the body throughout the process. So I think there's a lot of opportunity there and a lot of ways that we can step in as providers, and also that we can step in for our friends and our families and our patients going through this.
A really hard thing to address, because I totally agree with you that sometimes people are more stressed about the fact that they're stressed. So what I like to tell patients is the amount of stress that you would need to really cause you to not get pregnant is the type of stress that increases your cortisol levels, that it affects your brain to ovary axis. And you would see that through one of your vital signs, which is your period. If your period is irregular or something like that, that's like, okay, your stress is at that level. But for the most of us, we live with a certain amount of stress, and a lot of people are still getting pregnant. So I don't ever want a patient to think, like, I really hate when people say, just relax and you'll get pregnant. Yeah.
Or like you need a vacation.
Yeah, very, very annoying.
Yeah.
So I think it's really like, but at the same time, I don't want to downplay stress too much. There are stresses that decrease sleep, not poor nutrition, not exercising. All these things do increase inflammation in your body, and we do want to try and decrease all of that. Women with, for example, Crohn's disease or other autoimmune diseases, they have a hard time getting pregnant, and it's sometimes high quality and sometimes it's not. And maybe if we can decrease some of these autoimmune factors, decrease their inflammation, it could be a little bit easier for them. So
It's not covered by
it's covered by some insurances.
It's starting to become covered by more and more.
Yeah. So I will say that at HRC, we take every insurance that covers. A lot of insurances don't cover. So if you have coverage, if you work for a big company like Netflix, Warner Brothers, Google, they all pretty much have coverage for everything. Yeah. I wish it was more common. Maybe we'll get there. There is an IVF mandate coming up for insurances to mandate IVF, but as far as I know, everything is not part of that.
And it's also mandating it as an option. It's not like providers have to give it as an option. They don't necessarily the company doesn't necessarily have to cover it.
So you have to buy that coverage.
It would be offered like a vision or a dental supplemental, but that more companies have to at least give that option, and then some other companies will probably take the cost on because they want to provide it to their people. It's very misleading because when they're like, yes, it passed, now IVF coverage is mandated. It's mandated to be offered, it's not mandated to be covered by the company, is the difference. Probably in the $15,000 realm.
So
one egg retrieval cycle. Wow. Just to get around
13K at HRC, all inclusive, including the meds.
That's great.
And we actually have frequent promotions with 2K off. I will say that when you're comparing different locations, you really have to make sure you're comparing apples to apples. A lot of places will say we're $6,000 or $7,000, and they don't include anesthesia or the medications, which are each thousands of dollars.
Sometimes
the journey can be joyful and full of trust and hope. It does not have to be something that has to be stressful. It can be something that can be something that you can lean into. I I think that that's the first thing. I think the second thing is that it takes time for the body to produce eggs. So preparing the body for the fertility journey, and also preparing the body for a healthy pregnancy is really instrumental. I think that that's something that's not always talked about. I think that there's really an opportunity for it.
I should have said immediately, it's not her fault. I think that's the most important thing. I think women blame themselves so much. They think, what should I have done differently? What did I do wrong in life to deserve this? And it's just really important to know it's not your fault.
That's a really good one. And mine, as I already said, is everything takes longer than you want it to. You just always have to go forward with that attitude.
Yeah, no, I totally agree. And I agree with what Holly said also, which is we should be thinking about all of this earlier. I don't know, not to put you on the spot or anything like that, but I don't know if I agree with like this 3-month timeline. I think that really it's your whole life exposures. So if we could be talking to women younger and telling them, smoking too much, drinking too much, anything in extremes is really generally never good for your body. Being on certain supplements like CoQ10 could help. And so if we could just think of your eggs are in your body since you were born. Unlike men, it's unfair. I think it's making you for their whole lives. But our eggs are the same age as us. And so they have been exposed to your whole body's lifetime of exposure. And I think sometimes by the time they come to me, that only feels bad to tell them. But if we could be educating women younger, that an eating disorder isn't good for your fertility, don't go there. Like things like that would alter their course.
Really good point.
So often in women's health, we are looking at hormones as something static, when we know that we are very much different. We are dynamic beings, and interpreting hormones should not be used as something that's diagnostic, but rather as a tool that aids us in the interpretation of what's going on in a woman's life, whether we are evaluating her fertility or her pleasure. Hey, you guys, we just wrapped up Sacral. It was definitely a divine event. Had such a great time at this women's wellness experience. I thought the recommendations were great. The discussions were great. The questions were great. So kudos to you guys for being so updated with health and being able to ask such great questions and being so proactive about your health. I love that. So a special shout out to Angie from Weber Beauty and her husband. Thank you so very much, you guys, for the gift. I truly appreciate that you thought of me and invited me to this great event. You are absolutely right. This is my kind of space. So I had a great time. I just want to give you a special shout out. I'm so glad to have met Chelsea. We will be connecting, girl. And the final shout out goes to Rebecca. Girl, you doing a good job. Just want to congratulate you on your event. You did a great job. And thank you so much for allowing me to be able to be part of the audience, to attend, to really be able to take in everything that was given today and gifted today. Great to be in such a space with such amazing advocates for women's health and women's wellness. From beginning to end, okay? Okay, y'all, your girl is back. Can we do a little bit more of a wrap up? Is that okay with y'all? Okay, thank you. Let's get into it. So one of the things that I was really excited about are these new speculums. I haven't tried them out, so I can't give you specific feedback, but this is why I'm excited. I'm excited because they are so intentional in design. And so they seem to address some of the issues a lot of providers and patients have with the regular speculums that are available now. One of my favorite items today, and I'm not just saying that. Oh my gosh, these smell amazing. This eucalyptus, actually it's a shower bouquet and it's made by Weber Beauty. And what I like about it is that it comes with instructions on here. So it tells you exactly how to use them. You're supposed to hang them in the shower, not near water, and just enjoy and relax. Okay, get into the bouquet, y'all. Get into it. Whew, I wish y'all could smell this bouquet with me. Okay, this bouquet smells amazing. Whoever thought of a shower bouquet? Why not? We deserve it. This is what women's wellness is about. We deserve these simple pleasures in life. Y'all get your Wepa shower bouquet, because girls, whew, Okay, y'all know I like to share everything with y'all. So we're going to unbag. It's okay if y'all unbag with me. Okay. Thank you to M2B Wellness. Okay. They were the sponsors for today. So I want to get into this bag. Y'all are going to be surprised with me together. Let's get into what we have in here. Oh, we know this brand. Oh, yes. We absolutely know O positive. Okay. So supplements. Good. Okay, y'all ready for the next item? Let's keep on bagging, okay? Okay, let's see what this is. Oh, Vita's V-Wash. Vita's trying to wash that stuff out. Now, I do have to read these ingredients because y'all know how I feel about the V. She is self-regulating. So we're going to check out Vita's care and make sure that it is consistent with the things we like. But considering how intentional the organizers were, I'm expecting Vita's V to be up to par. Okay, let's see what's next. Okay, massage candle. Listen, they really trying to make us well. Okay, I can't wait to smell it. Okay, you know why not? Let's smell it together. Hold up. Okay, y'all. We about to melt this down and rub it on. Y'all, this really does smell really, really good. Oh my gosh. I am loving the name. Okay. Because they expect that when you are done with this, you're going to be like, well, shut your mouth. It says melt into you. Y'all see that? They not playing games. Okay, let me tell y'all what's in it. Okay, it is a combination of green tea, fig, Virginia cedarwood. I tell y'all, it smells good. Concepts about today was really about not just aging well, but enjoying our aging process. So I'm interested to enjoy this next product called Soul. I don't know if it has an accent mark over it, so maybe it's Soleil. I don't know. I'll make sure they correct me on it. But it has SPF 30 in it. It's a tinted cream. So I'm definitely going to... Let me do how those influencers be doing it. I'm excited about this. And so as we age and our likes and dislikes differs, or our responses to certain stimuli differs, it's a great opportunity to explore again who the new you is in this season. And so let's look at aging as just an incredibly beautiful journey in which we get to explore all the different assets of who we are. Okay, the next item, y'all know I am serious about gut health. You know that gut health is foundational, and I've talked about it from every aspect of life, from healthy breast milk and creating good gut health in a newborn, to your mood, to chronic diseases, asthma, allergies, name it. So, get your gut right. Are you going too often? Are you cramping? Are you not going often enough? Get your gut right. So one of the most fun conversations today and very informative was with Dr. Tubi. And it was probably one of the most fun because she dropped a lot of bombs that really surprised people. And I'm going to use platform safe words. And one of the exciting facts that she dropped was that the length of a woman's sensitive pointer is just as long as a guy's sensitive pointer. It's just as more internal. Okay, we are not done playing, y'all. Okay, because we have up next is Stripes, and this is Oh My Glide. Okay, play oil. I'm so excited about this conversation that we're having, and not just conversation. We are actually providing tools and insights on making sure everyone has a healthy SX life, right? Because it's part of your health. We don't call it SX health if it wasn't part of the health. But can I tell you guys, one of my absolute favorite messaging today, and actually a message I'm going to incorporate in my own life, is just the message of surrounding yourself with daily acts of gratitude, because the more you are engaged in the general and everyday pleasures of life and gratitude mindset, the more you are likely to experience the same in your sex health. Okay, let me break it down for y'all. An attitude of gratitude every day or in your routine life yields pleasure, and that pleasure can be experienced beyond your daily activities. It can be experienced in your bedroom as well. So gratitude yields pleasure in all aspects of life. Okay, and our final product is they're not playing. No pun intended, but they are not playing. So these are flushable intimate wipes, and I love that they are so earth conscious. Their ingredients are very much conscious about making sure we minimize toxins, and they include pH matched and includes chamomile and aloe. So you can't go wrong with this. One of the other things I really enjoyed that was mentioned, and I think we need to really lean into more, is just making sure that women know that you don't have to wait until the last minute to get information. Really empowering women with information early can be so life altering in such a beautiful and positive and empowering way. And so I'm glad that we all kind of feel the same. Let's get the information out there earlier. And to be well, y'all are real cute, because I love what you wrote on these cards, where it says the energy we shared lives on. That is so true. And the energy was the right energy in the room today. I was so honored to be in the room with you guys today, to glean and to really indulge in just such a wonderful atmosphere. So I thank you guys for allowing me to join you guys today. And I am looking forward to the future. And that's all I got for you folks. So this is Dr. T, the hand behind the handle of Healthy Bump Club, right here on YouTube, and healthybump.club on Instagram. I thank you guys for hanging out with me for the day. And I hope I was able to provide and share with you just great pearls of wisdom and gems from today. Did y'all pick up what we were putting down? I hope so. And if so, I hope to see you guys when the next episode. This is Dr. T, just a friendly reminder. Don't forget to comment, like, and share. And go ahead, why not? Click that subscribe button. Help us to get to the next 1,000 subscribers. We thank you guys for supporting.